Hello, and welcome to Conversations from the World of Allergy, a podcast produced by the American Academy of Allergy, Asthma, and Immunology. I'm your host, Dave Stukas. I'm a board-certified allergist and immunologist and serve as a social media medical editor for the Academy. Our podcast series will use different formats to interview thought leaders in the world of allergy and immunology. This podcast is not intended to provide any individual medical advice to our listeners. We do hope that our conversations provide evidence-based information. Any questions pertaining to one's own health should always be discussed with their personal physician. The Find an Allergist search engine on the Academy website is a useful tool to locate a listing of board-certified allergists in your area. Finally, use of this audio program is subject to the American Academy of Allergy, Asthma, and Immunology Terms of Use Agreement, which you can find at www.AAAAI.org. Today's edition of our Conversations from the World of Allergy podcast series is targeted towards Academy members and really anyone who's received information from the Academy's COVID task force during the past 3 years. Today's guest is Dr. Paul Williams. Dr. Williams is the current president-elect of the American Academy of Allergy, Asthma, and Immunology, and for the past 3 years, he's also served as the chair of the COVID-19 task force. Throughout his career, Dr. Williams has made numerous contributions to the specialty of allergy and immunology, and in particular has been heavily involved in advocacy across many realms. Dr. Williams, thank you so much for taking the time to join us today, and welcome back to the podcast.
Thank you, Dave. Happy to be back.
Yeah, I believe you're actually our first guest to return for a third appearance on the podcast, which is exciting for us. And I was looking through our prior episodes, and it's been almost 3 years actually since we recorded your two episodes. And episode 29 was released in May of 2020 during the very early stages of the pandemic and long before vaccines were available. When you think back to those initial days, what stands out in your memory regarding how you were affected personally or as you watched the public response in the early stages of the pandemic?
First of all, Dave, I want to thank you for the honor of being asked to even record a podcast, let alone for a third time. It's like hitting for the cycle in baseball. When I when I think back on the early days of the pandemic, I guess my first impression was really fear. As someone who was at risk because of my age, I was really worried about catching the virus and dying. I also worried more for my wife, who was working in the ER at the time, knowing her exposure was even greater. And I saw the same response from the public. None of us really knew what was going to happen.
Yeah, I echo those same sentiments. It was really a frightful time, and it's hard to believe that it's been 3 years already. Can you walk us through how the Academy decided to form a COVID-19 task force and the main goals for this group when it was first put together?
Sure. So, as you probably recall, at the beginning of the pandemic, there was a huge amount of information that was bombarding the public in general and the physician community. It was being called an infodemic at the time.
Mm.
Mary Beth Fasano, who was Quad AI president at the time, and I talked about somehow distilling all this information into something that was digestible and helpful specifically for the allergists and their patients. So we decided on starting a task force, and we got representation from private practice, academia, social media experts like yourself, the Office of Practice Management, and the regional, state, and local allergy societies. Since I was the one who brought it up, I was appointed chair.
Hmm.
Our charge was to provide a resource for allergists on COVID-19, which would benefit our members, their practices, and their patients. We decided on the weekly messaging and also the research page on the Quad AI website.
Yeah, as a member of the COVID-19 task force, as you mentioned, I've had a behind the scenes look at how the messages are put together, and I can attest that you've been the driving force since day one. And I know you well enough to know that you're too humble to say this, but I would like our listeners to know that Dr. Williams essentially spent the past 3 years reviewing as many studies and headlines as possible. You crafted the weekly, then biweekly messages, and then sent it to the rest of the task force for us to review and offer what were typically very minor edits. You've dedicated so much time and effort to this cause. How on earth did you find the time to do all of this?
Well, fortunately, I was semi-retired at the time. I was working 3 days per week, so that left a couple days on the weekend to put together the message. Now, actually, that put a lot of pressure on the other members of the task force who had limited time to review and edit the message before the release was sent out, all done within a week.
Mhm.
I fully retired in the summer of 2021, so that really allowed me a few hours each day to get it done and gave the task force members more time for review and editing. I have to give a lot of thanks to the Quad AI staff, though, for their assistance. They fielded all the questions that came up early on, and the communication staff helped format the messages. We also have a COVID-19 group among the staff who meet regularly and discuss pandemic resources on the website and even provide some information for the message. And then Dr. Andrew Moore, who's head of the website, has helped a lot in designing the research page on the website.
Yeah, there really are robust resources available through the Academy and on the website. And I believe, how many messages have there been so far? 139 as of this recording, is that right?
139 of this recording. We will end at 140.
Oh, my goodness. We're going to get to that in just a few moments here. Overall, when you look back, do you feel that the task force has been beneficial for Academy members? And what type of feedback have you received over the last few years?
Well, the task force has received a few positive responses in writing, and we really appreciate those. But I've had a tremendous amount of positive feedback in person when I've attended various Allergy Society or Quad AI functions. But perhaps the most consistent reward has really been the incredible open rates for these messages.
Mhm.
This has actually been increasing over time. And for the past year, it's been in the 50 to 60% range, and sometimes even exceeding 60%. And that's really incredible when you consider that the average open rate for messaging like this is about 16%.
Wow.
That tells me that members are interested, and I assume have been helped by our efforts.
Yeah, that's really fantastic. And I know the open rates, for those who aren't familiar, that's a great way for us on the back end to gauge, interactivity with the messages that go out and the websites and things like that. So 50 to 60% is fantastic, especially over the past 3 years. And along with the ebb and flow of the pandemic and how its impact has varied over the past several years, the type of information that has been included in messages from the task force have changed as well. In your view, how has this evolved over time?
Well, it definitely has changed, Dave. In the beginning, when little was known, our focus was mostly on symptoms, testing, keeping our members, their staff, and their patients safe. We talked about procedures in the office and screening patients and PPE and resources for PPE. Then the evolution of the virus and the efforts by public health, the government, and the NIH to keep up gave us additional information on diagnosis, treatment, and vaccine. We also had to battle misinformation and disinformation over the past year or so. And over the past year or so, we pretty well settled on a pattern of discussion on vaccines, the ever-changing variants and subvariants of SARS-CoV-2, development of treatments and evolution of treatments for outpatient disease, and a little about long COVID. The Quad AI and some of the task force have actually had some conversations with the CDC over time, and a few with the White House COVID-19 task force about messaging, and that's helped focus our statements. We've been trying to provide data on the efficacy and safety of the vaccines, encouraging their use, and also the use of the oral antivirals that we now have.
It really is. It's been comprehensive from the get-go, and the one of the last messages that came out, I believe, in early May, is message number 139, and you included something that really struck me. It was a study that looked at all of the preprints, so all of the research and the publications that went out before peer review, and how what a large percentage of those were inaccurate or never actually made it through peer review. Can you offer some comments on why that's so important and how that impacted the response during the pandemic?
Sure, Dave. That's a good question. We've tried to avoid preprints in our messaging because our concern that things would change or the data wouldn't be published. Unfortunately, the press used a lot of these preprint servers as sources for their information. And I think that's what led to a lot of confusion in the public. And this study showed that I think it was about 20% of these studies never got published. And although the ones that did publish didn't change a lot, there was a difference in some of the recommendations based on peer review. So I think there's still a little bit of a danger about using a preprint.
No, I agree. And it harkens back to the days when the vaccines were first rolled out, and we were seeing those what we now know are rare cases of anaphylaxis to the vaccines, but every single one of them was being reported in real time, and nobody was taking time to really step back and digest and figure out, what was actually going on at the time. And boy, that combined with the preprint information, information is flowing so differently these days, and I think all of us need to just kind of pause and reflect and truly understand things, especially before we act on it.
Yeah,
Yep.
it's still an infodemic,
Oh my
but it's
gosh.
calming down. Yeah.
At least in regards to COVID.
Yes.
uh, Early on in the pandemic, I read something that talked about how pandemics don't have a clear stopping point. There's no, end credits that roll like when you're done watching a movie. And historically, as disease transmission or severity lessens, societies just sort of resume life, sometimes in new ways, sometimes not. Do we know if we've reached the end of the pandemic stage, and can we now consider SARS-CoV-2 to be endemic? And if so, what's the difference between these two?
Well, by definition, I think it's a matter of degree. A pandemic refers to the widespread occurrence of a disease on a national or global level. It becomes endemic when there's a regularly occurring disease in an area or community. And as Tony Fauci said some time ago, I think we're in a transition phase now. The disease is still widespread in the world. India just recently had another surge due to a new variant. We have vaccines, treatments, and prior immunity that's resulted in a decline in hospitalizations and death. And so it's become more controllable, you might say. From a psychosocial viewpoint in the US, however, we're no longer in a pandemic, and the country really wants to forget about it. I think the fact that only 16.8% of the eligible population has received a bivalent booster says a lot about how the country feels. There's still a lot of disinformation out there, a distrust of science and the government. It's making control of this infection difficult. The Quad AI task force has been trying to educate our members on the efficacy and safety of the vaccine and the use of oral antivirals when appropriate so they can pass that information on to their patients. Fortunately, people still trust their personal physician, and that's why we're giving them the tools with our messaging. So recently, I had a gentleman stop by my house to ask a question about the neighbor, and it was when I was just recovering from COVID myself. And I told the gentleman, you might want to stay away. I have COVID. And he looked at me with surprise and said, oh, you mean that's still an issue? So,
Yeah, so to be clear, and I'll reiterate what you said, and I'm sure everybody knows this, at least I hope so. SARS-CoV-2 is still absolutely causing infections, illness, and even death at this time. But as all viruses do, this one has mutated multiple times as it adapts to various forms of immunity in the general population. What do we know about the most prevalent strains that are circulating right now?
well, these numbers change weekly, but what's interesting and fortunate for the public is that all of the circulating strains for the past year have been variants of the Omicron strain.
Hmm.
So there's some protection from prior infection and vaccines. Although we are still seeing over 1,500 hospitalizations and 1,000 deaths per week, but these numbers are all declining. The most current subvariants in order of frequency estimated by the CDC as of April 29th are XBB 1.5 at 69%, which has actually been the most common since early February. XBB 1.16, so-called Arcturus variant, has increased about 50% to 11.7%. There's XBB 1.9.1 at 9%, and XBB 1.9.2 at 3.7%, and a few others that are all less than 3%. XBB 1.5 is declining, and all the others I mentioned are increasing, which suggests that they do have a little more infectiousness and immune evasiveness than XBB 1.5.
Mm. Watching the mutations and our ability to track them over time is just fascinating to me. And I don't mean to put you on the spot, and you may not know this, and I don't know the answer to this. Do we know, is the alpha variant still circulating, or is that just simply gone?
That's gone. It's not, doesn't even appear on the CDC tracker anymore.
Oh boy, that's really interesting. And early on in the pandemic, the United States government enacted various stages of emergencies, which allowed for either new funding for services, the creation of new services, or extension of other services. And in April of this year, in 2023, the U.S. government ended the national emergency, and on May 11th, the public health emergency will come to an end. It seems as though the end of the national emergency mainly impacted healthcare services that were enacted during the pandemic. Can you give us some more background and information regarding that?
Sure. The declaration of the public health emergency allowed the Department of Health and Human Services to make a number of changes in the way that healthcare services were provided and paid for, as well as increases in patient support in Medicaid and SNAP or food stamp programs. The federal government, for example, waived copays and coinsurance for testing and treatment of COVID-19 because they paid directly for the tests, vaccines, and treatment. The public health emergency also allowed for flexibility in the provision of telehealth, which is really a game changer for all of us. More patients became eligible for Medicaid, and supplemental nutrition benefits actually increased.
What main changes are going to take place when the public health emergency ends in May?
Well, there are going to be a lot of changes, but fortunately, Congress extended the telehealth flexibilities until the end of 2024.
Hmm.
But now patients are going to be responsible for copays and coinsurance for tests, vaccines, treatments, and office visits for possible COVID. The Advisory Committee on Immunization Practices placed the COVID-19 vaccines on the list of recommended vaccines. So fortunately, under Obamacare, insurances are going to have to pay at least some of the cost of these vaccines. But unless Congress decides to provide the funding to purchase more tests and vaccines, it will be left to the commercial insurers to decide what they will pay for. Other significant changes that certainly could have an adverse impact on our patients include a reduction in food stamp benefits, which could adversely impact our food allergy patients, particularly those from underserved populations. There's also going to be a reduction in eligibility for Medicaid. In addition, data sharing requirements will come to an end. So state and local health departments, hospitals, and commercial labs will no longer be required to pass information on to the federal health officials. Tracking the virus will become more difficult. The New York Times and Johns Hopkins University, both of whom were reliable sources for case counts, hospitalizations, and deaths throughout the pandemic, have also stopped collecting information. Kind of puts us back to where we were in the early days of the pandemic, unable to accurately track cases and spread. Fortunately, the CDC is currently negotiating with state and local health departments to share data, and tracking will likely resemble the seasonal flu surveillance, which people don't necessarily understand, but it uses information from sample sites. But the results are going to be certainly less granular, and there are going to be some blind spots, and patients will be adversely affected.
Wow, that sounds like a lot of changes happening relatively fast as well. Well, I guess along those lines, the Academy COVID-19 Task Force is going to stop sending biweekly messages on May 15th. Why was that decision made?
Well, it was really a combination of factors. Messaging fatigue, perhaps, to some
Hmm.
extent. But the ending of the public health emergency really kind of gave us a rationale for ending the messaging. But I'm seeing that the messages continue to be very popular, so we obviously have to do something about that. Now, much of the literature that's coming out now is becoming more repetitive, or it actually relates to previous versions of the virus, so it may not be applicable to what's going on right now. There are no new vaccines or treatments at this time, and the variants are just different versions of the same Omicron suit. We're really running out of new things to say, and messages are getting shorter. Earlier in the pandemic, when I'd write a message, in order to keep it a reasonable length, I would move many things to the subsequent week. And we were ending up with messaging that was almost completely full for the next message before we even sent out the message we were working on. So things have changed certainly in that light.
Hmm. Oh, makes sense. Well, will members of the Academy still be able to access the information that was provided in all of the previous messages or the other resources that we talked about related to COVID-19? And if so, where will they be able to find it?
Well, all of the previous messages are currently archived on the Quad AI COVID-19 resource website and will continue to be there. In addition, we're going to try and update the website to provide new information and links for members to access important information to make it sort of a quick reference for things that they need to know about COVID-19.
You sort of alluded to this, but does this mean that the Academy is not going to send any new information out related to COVID-19 in the future, or are there still mechanisms in place to ensure important information will be shared if and when it's necessary?
Well, if there's new information on variants or vaccines or treatments, it will be communicated with the membership through either an as-needed task force message or in other Academy digital publications. So, for example, Practice Matters or the regular news from the Academy may have some segments in there. There's also still the Ask the Expert feature, which has been responding to COVID questions throughout the pandemic.
Mm-hmm. Well, Dr. Williams, what are you planning to do with all of your newfound free time?
Right. Well, spring's finally arrived in the Pacific Northwest, so it means more time for me to spend in the yard, which I enjoy. But also my wife and I will be able to visit family members in different parts of the country without worrying about coverage for the messaging.
Uh,
But shortly I'm going to need to start preparing for next year's meetings and so on.
yes. Well, I'd like to transition to that if that's okay as we wrap up our conversation. And you've spent many years serving various leadership roles within the American Academy of Allergy, Asthma, and Immunology. When and why did you decide that you wanted to take the path towards becoming president?
Well, I've always been interested in the organizational medicine and society. So accepting offered leadership positions was naturally something I wanted to do. You know, it's always tough to get a volunteer to do something. I never planned on being on the board of directors, although I certainly welcomed the opportunity and was excited about serving. But even then, I never thought that the presidency was something that could happen. The membership is probably not familiar with the process, but requirements for progression to senior leadership include previous board service. And everyone who has had previous board service is actually asked if they're interested in running. And two of my former partners were actually presidents of the Academy. And so I was excited for the opportunity. So I threw my name into the hat and didn't really think I would be nominated. Then I didn't think I'd be elected, but here I am. And I really enjoy giving back to the specialty by serving.
We recently had our current Academy president, Dr. Jonathan Bernstein, on the podcast, and he seemed pretty fresh and energetic during his first 6 weeks in the role. As president-elect, what types of responsibilities do you have, and have you already had to tailor your schedule a bit to meet these demands?
Well, surprisingly to me, there isn't a lot of responsibilities for the president-elect until later in the year. I did get included in the leadership meetings with the World Allergy Organization, the European Academy, and the college, which took place at our annual meeting, and the same will occur at the college meeting. I was invited to moderate a Quad AI session at the WOW meeting this spring, the World Allergy Organization. I do have to attend the biweekly executive committee phone calls and will be attending the academic leaders and program directors winter meeting next January. But since I'm retired from clinical practice, I do have time in my schedule for this, although I have to work my vacations around it to some extent.
Mhm. And you will officially take over as president of the Academy on February 26th, 2024, at the annual meeting, which will take place in Washington, D.C. Have you started to think about your own presidential initiatives? And if so, can you offer us any hints?
Well, I've been thinking about my initiatives and even discussed drafts of them with the staff. I have to present these draft initiatives at the June board meeting in just a few weeks. My ideas, not all of which may happen, include an extension of the environmental theme of Dr. Bernstein, but with more focus on education and advocacy. I'd also like to work with the communication staff on a couple of fronts. One, I'd like to increase internal communications within the Academy so that intersections and committees can more easily see what others are doing in the Academy, hopefully to stimulate collaboration and new ideas. The second would be to develop external communication targeting government, academic division leaders, payers, and the public about who an allergist is, how important they are, and how they can help. I'd also like to establish a proactive working relationship with payers to avoid barriers in practice. Right now, we're sort of going backwards in a whack-a-mole sort of approach to try and appeal all the different policies that are throwing up barriers to practice.
Well, I look forward to seeing you kind of finalize these and formalize them. And if I haven't been kicked out by then, can we count on having you back for a fourth episode once you become president to talk more about these?
Sure, be happy to.
You'll be so sick of me by then.
No way, Dave.
Well, Dr. Williams, it's really been a pleasure having you join us again. And I'd also like to offer a truly sincere thank you for what I know the countless hours and tremendous effort that you've put forth to help all of us steer through the pandemic. I've learned so much from the information you've put together for us. And for me personally, it's really been a pleasure working with you. Our listeners really do enjoy learning more about our guests. And before we depart, can I ask you some more rapid fire questions?
Absolutely.
All right. Well, I appreciate that. So this first one may be a little more difficult or challenging, but as you look back and reflect upon the past few years, the pandemic, what do you think was the worst aspect of the pandemic for you personally?
Well, I think the societal divisions on all aspects of the pandemic and all of the tremendous waste of effort that was needed just to convince people of the value of vaccines and treatment and counter the deniers and conspiracy theories. That's really the worst aspect for me.
Yeah, it is. It really has been very, very unfortunate. Well, let's make it a little better, perhaps. So, did you experience any unanticipated bright spots that occurred because of the pandemic?
Sure. The development of telehealth and its general acceptance among patients and payers is probably the brightest spot and hopefully will continue. But I also have to mention that the tremendous collaboration between the public and private sectors in the development of treatments and vaccines, and that needs to continue as well.
Absolutely. I've already seen some interesting preclinical research looking at using these mRNA technology to treat food allergies. So I think that, yes, I agree with you. It's been great to see that collaboration. At our recent annual meeting in San Antonio, Dr. Peter Hotez, who's been very involved in a lot of this, delivered a keynote address and somewhat casually mentioned, which I kind of looked around the room to make sure he actually said it out loud. He mentioned when, not if, the next pandemic occurs. And historically, we know that this won't be our last. What do you hope we'll do differently as a society in our response to the next pandemic?
Well, I sincerely hope we will use what we learned from this pandemic to be prepared for the next, but unfortunately, I'm skeptical about that. I think that we as medical people are ready for that, but I don't know that the general population is. Did you know that, for example, that legislatures in 30 states have passed laws restricting public health measures in the last year? So I'm going to be promoting advocacy from our membership to hopefully counteract this negative approach.
Yeah, I think, yeah, as you mentioned, the fight is not over. And in some ways, I think we're even less prepared for the next pandemic, perhaps, with all the divisiveness that we see. It's really unfortunate. Okay, on a more lighthearted note, what's your favorite meal of the day, and what is the ideal food for that meal?
Wow, that's a toughie. I really have to say dinner is probably my favorite meal. And my ideal isn't always what's best for me, but I probably prefer chicken or fish, a green salad, and a good glass of red wine.
Okay. Well, one last question, if I may. What's your favorite type of vacation or vacation spot, and have you had the chance to travel there recently?
Well, I love to go to Hawaii, and fortunately, I've been able to go there for the Western Society of Allergy meeting this past February, and we'll be going back this month for the World Allergy Organization special focus meeting. But I also just go for fun at least once per year and try and arrange for relatives to join us.
Oh, that sounds nice. And when you're there, is it more of a you like to lounge on the beach and relax, or do you partake in hiking and other activities, or kind of a mixture?
Well, it's kind of a mixture. I'm not so much of a beach person, but I do like to lounge near the pool and relax.
Sure, absolutely. Well, Dr. Williams, thank you again for taking the time to be with us today. I think that this was another insightful conversation. Is there anything else you'd like to add before we depart?
Dave, I'd just like to say I've enjoyed all of the podcasts that you've done and think you're doing a fantastic job. And how do you find the time?
Well, thank you very much. I get to do what I love. It's fun. I hope people, get that I hope that comes through during the conversations. And frankly, I mean, yourself and leadership in the academy, you kind of just let me do whatever I want to do. So thank you for that.
You're welcome.
All right. Well, thank you again. We hope you enjoyed listening to today's episode. Please visit www.aaai.org for show notes and any pertinent links from today's conversation. If you like the show, please take a moment to subscribe to our podcast through Apple Podcasts, Google Podcasts, or Spotify so you can receive new episodes in the future. Thank you again for listening.